There is so much information out there about pregnancy and raising children. Sometimes it's hard to know what is true and what's false. That's the point of this video. We're bringing in Sandy Artinian, DOHC's Maternal Nurse Educator. I just want to get right to it. I'm going to give you a list, and let's just figure out, is this really true? Is it false? Because I want to give these moms a little bit of clarity out there, okay?
Okay, great.
All right, first thing on the list, you should skip the flu shot when you're pregnant. True or false?
That's false. You really want the flu shot. Some people worry that you'll get the flu from the flu shot, and you won't. It doesn't have a live virus, so you can't get the flu shot. Some people worry that there's preservative, and that would be bad for the baby. There is no scientific evidence at all that it would harm the fetus at all. There's nothing that's ever come out that has proven that. When you're pregnant, your immunity is actually lower, your immune status is lower. So having the flu shot helps you, protects you. It also provides some coverage for your baby as well. It gives your baby some immunity as well. So it is really good.
All right. True or false, you're eating for two?
That's false, unfortunately.
No.
The first trimester, you should be eating normally. And then trimesters 2 and 3, you add about 300 calories more. And that's about a half a glass of skim milk and a turkey sandwich. So it's not much, or, cheese and crackers. It's not that much more. If you're normal weight, the weight gain should be around 25 to 35 pounds. Your doctor's going to guide you on what's right for you.
Okay. Next up, true or false, you should avoid hair dyes.
We used to think that, but that's actually false. Even though you do absorb some chemicals through your scalp, it's in such a minimal amount that it doesn't show up in your bloodstream and it doesn't harm the baby. So that's something you can continue.
Okay, we can keep up our highlights. That's good. True or false, avoid caffeine.
No, you don't have to avoid caffeine, but you do want to limit caffeine. You want to keep it at 200 milligrams of caffeine or less. That would be 1 8-ounce cup of coffee, 2 shots of espresso, believe it or not. And that's about what you could do for the day.
All right, so you can still have a little bit to help with that fatigue, right? Okay, this is a good one. Exercising can hurt the baby. Is that true or false?
That's not true. Exercising is extremely good for you and for the baby that's developing. They actually recommend that you exercise 30 minutes a day, at least 5 days a week. Things like just walking, mild exercise is fine. Whatever exercising you were doing prior to pregnancy is good. If it's extreme, that's something you want to talk to your doctor about. But generalized exercising is excellent for you and your baby.
It helps with energy and just helps you feel good about yourself, right, throughout the process. 1 glass of wine is okay when pregnant. True or false?
That is false. The American Academy of Obstetricians and Gynecologists, no amount of alcohol is safe while pregnant. It can cause birth defects. It can cause preterm delivery. No, you got to wait on that one.
It's just not worth it. All right, breastfeeding can always come naturally. True or false?
Unfortunately, that's false. Breastfeeding is a natural process, but it can take some time to get started and to get off to where you're feeling like this is a natural process. So there's lots of support for you to get it going. It could be tricky to get started, but have confidence, ask for help, and you could be successful.
There's a lot of resources out there people can find, or a video that we filmed as well to see what our conversation was.
That's right.
Next up, postpartum depression only affects weak mothers. True or false?
That's not true. Postpartum depression is, you probably heard about it more. It does affect quite a few moms. Baby blues is a very common thing, and that actually hits about 80% of moms. And that's where you're, after you have the baby, you're crying for no reason, you're gonna have these mood swings, those kind of things. And it usually lasts 2 or 3 weeks, and then it goes away. And then there's also actual postpartum depression, which is more depression-like symptoms. And that's fairly common. It's about 20 to 30% of women experience that.
And it's very important to ask for help, to seek help, or if you're the spouse, the partner of somebody who's experiencing postpartum depression, to seek them help if they're in that situation.
That's right. Your obstetrician, your primary care provider, can help you. We have resources for mental health. So there's lots out there, and it's really important to get help. For you to be the best mom, you need to be able to take care of yourself and to be able to take care of your baby. So important.
This is another big topic. True or false? I'll be able to get my body back after a certain amount of time.
The certain amount of time, you know, that's really hard to predict. Your body goes through so many changes when you're pregnant. Your breast, your hips, your feet. You know, some women's feet grow and never go back to the same size. So as far as getting back to you'll see things like in 6 months, you should be back to your pre-pregnancy size and weight. And it's different for every single person. Some will get back, and some people's bodies change forever. But the best bet for you is moderate exercise and a healthy diet.
Or we sometimes compare ourselves to celebrities we see in the tabloids that got their body back after 3 months, but little do we know that they have private chefs and personal trainers and all the things, right, to make it, not that it's ever easy, but definitely to help them, that most moms just don't have that kind of access.
And what they did during pregnancy as far as their weight gain and things might not have been necessarily safe, in the safe range.
Sure.
So you've got to give yourself grace. Everybody's different. And as far as the celebrities, we also see some that struggle, and boy, everybody's so hard on them. But give yourself time. Definitely. You'll get there.
And this is another good one. You shouldn't hold your baby so much or you'll spoil them. Is that true or false?
That's false.
Yeah, you can't spoil baby, right?
Holding your baby is essential for baby, their development. It improves self-regulation for the baby if you hold them. There's no harm that can come from that. So that is something that I strongly urge you to disregard if you're getting family members or friends who are trying to be helpful to say you're spoiling the baby. You're growing a super well-adjusted baby by holding them.
And last one, true or false? Newborns should stay inside.
No, that's a myth. Babies are good to go outside as long as they're dressed appropriately for the weather, that they're not in direct sun too long. But you do want to refrain from being around large groups of people. The babies don't have immunity against a lot of the diseases, and they don't start having vaccines till later on. So you really want to limit large groups of people with the baby.
Until around what time? When can you start bringing them to family parties or the zoo or a restaurant?
Well, that gets tricky with family parties because a lot of people want to have them. But when they start getting their vaccines, then you can start doing that. There are some cautions you want to take, however. You want to let people know that if they're sick, they shouldn't come around. And that's a conversation you need to have. When they do come around, you want to make sure they're washing their hands before they hold the baby. And really important, you shouldn't let people kiss the baby. You don't want to spread diseases to your brand new baby that is very susceptible to things. But barring that, they can be, once they have those vaccines, you can start having them around people.
Such good information, because there's, like I said, so much information, but also misinformation out there. It's just a bit comforting to get this kind of clarity. So thank you.
Thank you.